Welcome to today's webinar. County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute. This webinar is brought to you thanks to the contributions of colleagues and partners in Wisconsin and across the nation, with support from the Robert Wood Johnson Foundation. It is produced in collaboration with Healthy Places by Design, an organization that advances community-led action and proven strategies to ensure health and well-being for all. The University of Wisconsin-Madison occupies ancestral Ho-Chunk land, a place their nation has called Dejo since time immemorial. Today, UW-Madison respects the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. This webinar will be recorded. All speakers' views are their own. Guest bios and slides from today's webinar are available on our resource page. We will share a link to the resource page when the webinar begins. Stay up to date on all things CHR&R. Find us on Facebook, X, and LinkedIn. And if you haven't already, sign up for our newsletter by scanning this QR code with your phone's camera. It's the best way to find out about upcoming webinars, our podcast, and our latest tools and resources. For your convenience, the QR code will also continue to be displayed for the remainder of this short video. Your facilitators today include our host, Erica Burrows-Girardi, with support from Outreach and Facilitation Specialist, Soraya Williams-Neal, and the Senior Project Director from Healthy Places by Design, Joanne Lee. We invite you to continue the conversation. Join our discussion group immediately after the webinar. Joanne Lee will be our lead facilitator. And watch for a chat from Soraya for details on how to join the group after the webinar.
Welcome to Meeting the Moment, navigating a quickly changing public health landscape. Hi, my name is Erica Burrows-Girardi, and today's webinar is the first in our Meeting the Moment summer webinar series. I'll share more about this series in just a second. The purpose of our webinars is to share lessons, successes, and relevant resources and links. CHR&R's webinars reflect the values that we hold as part of the University of Wisconsin Population Health Institute, values of collaboration, integrity, excellence, innovation, inclusion, and courage. So these are the values that we aim to model during the webinar, and we hope that you will too. With that, I want to introduce you to the team that's going to aid in your learning experience. So let me start with Joanne Lee with Healthy Places by Design. Hey, Joanne.
Hello, Erica, and hello and welcome to everybody in our audience today. We invite you to join the conversation and engage with us during today's webinar. And there's two ways that you can engage. You can ask panelists or our panelists today questions by using the Q&A box. So you can go ahead and open the Q&A box just for questions specific to our guest presenter today. Now, we'll answer as many questions as we can during the live webinar, but remember, we do also have the post-webinar discussion group for some extra time. The second way that you can engage today is by engaging with each other through the chat box. So you can see the chat has already been busy. Use that group chat box to introduce yourselves, comment on learnings, or share your knowledge and experience with the topic. Soraya is actually in the chat box moderating. I'm going to turn it over to her because she's going to share a little more information to help you enjoy today's webinar.
Oh, thanks, Joanne. Hello, everyone. And like Joanne said, I will meet you in the chat. To participate fully, be sure to set your settings to everyone so we can all see your chat. And as you can see, it's already lively. We ask that you adhere to our group agreements, which I will drop in the chat shortly for more productive interaction. And for now, I would like to introduce you to our technologist of today, which is James.
Thank you so much, Sarai. I'm James Lloyd. I work with County Health Rankings and Roadmaps, and I'm here to help make sure that our technology works as well as it can. I want you to have a good experience as you're participating today. And so if you have any issues, please also try to reach me in the Q&A pod. That's the easiest way for me to track and reply to you. So, Erica, I'm looking forward to this webinar. This is going to
Yeah.
be good. So I'll hand it back to you.
Thank you so much, James. Yes, our entire production team and all of us here at CHR&R, quite frankly, been looking forward to starting this series. So we hope that you will enjoy it. Have you seen our new model? I hope you have, because we debuted it in March and we've been sharing it through every webinar. The reason why this new model is so important is because it shows the relationship between power and societal rules. It's what we call that power and societal rules equations, what we call structural determinants of health. Now, these rules shape the community conditions that influence health, and community conditions are where we find opportunities to make healthy choices. Written rules show up as policies, budgets, and regulations. Unwritten rules are just as important because things like narrative, institutional practices, which are unwritten rules, can be just as influential. In fact, they often underpin the policies that we see that affect our lives. So we are just seeing these impacts of power and societal rules more explicitly than we have in the recent past. And it's one of the reasons why we created the Meeting the Moment series. There's no doubt that public health is experiencing perhaps the most challenging period in its history as a field. Funding, data, valuable like preventive guidance, even services, right, are being suspended, even withdrawn. And we know that public health practitioners need support now more than ever. So, during this three-part series, we're going to examine together how we can meet this precarious moment. From every challenge emerges opportunity. And our goal is to uncover those opportunities, to organize, to advocate, to make a difference, even as we workshop the challenges that we're all experiencing. So remember that each webinar will be followed with our traditional discussion group. So please plan to join us not only for the webinar, but for the discussion group that's going to follow, because we're going to unpack so much of what you're going to hear in the webinars. In August, we will discuss how to use data to make meaning of new policy impacts. We're going to hear from Beyond 2025 Action Hub at Boston University School of Social Work. They're doing great work over there, and I'm so excited that they're going to be on our platform next month. We're going to hear from Commissioner George Dunbar from Mecklenburg County, North Carolina. He's going to share insights from the National Association of Counties, also called NACO, but also as an elected official. Our very own Christine Muganda will introduce a new data tool to help you strategize for advocacy. In September, we're going to hear from funders to unpack how philanthropy is responding in this moment. We're going to hear from Paul Kennedy, president of a community foundation serving a rural area in Alabama. Chantel Hill from the Winthrop Rockefeller Foundation, based in Little Rock, Arkansas, will join us to share how her foundation is marrying faith and narrative to build equity. And then we'll hear from Carolyn Brunton with the W.K. Kellogg Foundation, who's going to share her perspective on, well, their perspective, the Kellogg Foundation's perspective as a national funder. And of course, we could not think of a better way to kick off the series than by having the American Public Health Association be present with us today. So these are going to be frank conversations. Our guests are weathering what we are weathering. They are challenged like we're being challenged. They're facing obstacles just like we're facing obstacles. And they're not shrinking away. And that's the good thing. So plan to be with us throughout the summer. With that, I'm excited to introduce you to Dr. Susan Polan, who's the Associate Executive Director for Public Affairs and Advocacy at the American Public Health Association. Hi, Susan.
Erica.
I am so excited that you were able to join us today, and I'm going to interview Susan in just a second. But first, one more plug for that discussion group. I want to remind you all that we will be unpacking what we're going to discuss today in today's discussion group. They're facilitated by Joanne, and they always give you the opportunity to share and learn from others. At the end of the webinar, Soraya is going to chat out a link so you can register and join the discussion group. So be looking for that toward the end of the webinar. Also, look for this webinar's discussion guide, resource guide, that's going to include links to resources shared by Susan, as well as participants from the discussion group. So we'll be sure to email you the resource guide before the end of the week. And with that, Susan, welcome back. I want to, let's start with a very practical question about APHA, or the American Public Health Association, which we all know as APHA, so we'll call it that for now. But we know that the association was founded in 1872. What was public health focus when APHA was founded, and how has that focus shifted over time? We see your
Let me
slides
start.
now. You're good.
Good. So let me start just by thanking you, thanking the team. This whole process of getting us here have been a pleasure. Let me also acknowledge what you said, which is basically we are in difficult times. So to everybody who is listening, I'm going to apologize in advance. It's been a tough few months. It's been a tough week. And as much as I want to think about ways that we can all work together to make things better, there are some real challenges that we face. And so if you hear some of that come through, please know we're trying our best. So to get to
Susan,
your question.
I just want to say, we appreciate your authenticity. I don't think we can truly meet this moment unless we're completely honest and authentic. So thank you so much. And we understand your preface. Thank you.
Thanks. So APHA, as you said, was first founded in 1872. Over the course of the 150, almost 3 years, we have been through a number of different challenges. We have done a number of different things, but we are now working under this guise of our mission being build public health capacity and promote effective policy and practice and optimal, equitable health and well-being for all. But back in the but the other thing that's so critical for APHA is that we bring folks together, we convene, and this year we are here in DC focusing on making the public health a national priority. And the truth is that we made that decision 2 years ago, and the fact that it is so incredibly timely is a bit of serendipity, but it is really what we are trying to do right now is make people understand what public health is, what it means for this time, and what it is that we can do together to make the public's health better. So to take us back to the 1870s, if you look at this is a timeline that we did for our 150th anniversary. And if you look closely, and I know it's a little challenging, many of these things are about infectious disease. It's about what is communicable disease. It is about setting up the systems for creating a healthier public. And we know that in the last 153 years, we have made amazing gains in addressing some of these challenges. We have expanded the life of people who live around the world because we have understood what the differences are between being able to prevent these diseases and then just be reactive once it's too late. So early on, we were thinking about issues very much around the environment, drainage, sewage, the John Snow lessons about pump handles and water. And what are the systems that we need in place to monitor these things and to make sure that we are doing a better job of addressing the issues that we're meeting head on. Since that time, we have been able to be a little bit more strategic and not as reactive in thinking about what we know when it comes to disease and what we know when it comes to health. So I think everybody in this audience would be able to understand this slide in ways that not everybody does, that the biggest threat to health in the US is not things that we are, that are that are the chronic issues, the biggest threat to health is in preventable disease, and that includes the chronic. But just because you have access to care doesn't mean you're going to be healthy. It is so much more than that. And I will talk a little bit about the social determinants, or the various phrases that we know, and the impact that that has had to create and move us toward good health. This is a slide that I use in almost every presentation I give, and it's not because people don't understand it, but because it's just so nice to see it all in one place. When we're talking about health, we're talking about so much more than healthcare. And for an audience of public health professionals, this is a second nature to you. This is language you understand, but it's, I think, just good to ground us all in the same place, that we need to make sure that we're thinking about health in a holistic way, that we're thinking about the upstream things that really create health and the upstream things that can hinder health. There are lots of different ways to think about this. RWJ did some work a few years ago where they looked at metro areas and the difference in health from inner city to the end of a metro line, for example, in DC. We've seen the implications of this in every single thing. We see this in health disparities. We see this in inequities. And these are really important considerations when we're talking about health. And this is really where APHA spends our time, trying to make people understand that public health is in fact everywhere. It is the opportunity to be healthy because you have a job, because you're reading at a third grade level when you're in third grade, which means you're more likely to graduate high school on time, which means your long-term life expectancy increases because you have basic literacy. So all of these things are so interconnected. And that is both the strength and weakness of public health, is that we have to make people understand this, and we have to make it relevant, and we have to make it tangible. And this is very hard because an intervention for a Head Start kid to make sure that they have access to food and be able to read by the time they're in third grade is really hard to make it understand that in 35 years they're not going to have cancer, and those are the kinds of connections that we really are trying to make.
Yeah, absolutely. One of the things I wanted to say, can you go back to that slide? Because
Hopefully.
when we look at a lot of those health indicators that you have posted on these slides, those of you who know county health rankings and roadmaps well, and you know our measures, a lot of these are the same measures that you're going to find on your county snapshot for the very same reason that Susan just described. Because these indicators, these conditions, we now call them in county health rankings and roadmaps language, we call them community conditions. But these community conditions is what set us up for either good health or challenging poor health. And so that's one of the reasons why we have so many measures related to those exact same social determinants of health. But thank you for sharing this slide. I want to ask you about public health. We are in a challenging time. There is no doubt about it. But we are a resilient field. And by that, what I mean is that even though the challenges that we're facing today might be a little bit unprecedented, we have weathered a number of obstacles for decades. From anything from managing funding losses to responding to disease crises like HIV/AIDS, the COVID-19 pandemic. Susan, what seems particularly different and troublesome in this moment? And seriously, where do we go from here?
So I completely agree that in the past we have had challenges, but we have never had challenges like this. And part of the reason we've never had challenges like this, because it's not one thing. It is all of these things. It is money that is being taken back. It is money that is not going out. It is agencies that are being restructured or closed. And I think everybody's heard about the fact that just yesterday, more than 4,000 people were told at 4:59 p.m. that as of 5 p.m. they were no longer employed by the Department of Health and Human Services. It is the reorganization, so the creation of new agencies that are supposed to do some of the same things, which with far less money and a focus that is not necessarily on the prevention and upstream things we know are so important, but are focusing more on the issues related to prevention or to treatment. It is, as I said, the rifts and the layoffs that are unfortunately now supported by the Supreme Court, and giving the administration the ability to do some of the things that they have wanted to do since the moment they entered office. It is the budget reconciliation package that passed just a week and a half ago that that I can't even speak to it in terms of how it decimated the Medicaid system, how it is going to impact people in the short and long term in ways that we don't even have a handle on yet because the changes are so dramatic. And then it's this underlying distrust of science and the idea that what public health professionals who have spent their life trying to make the world a better place, trying to keep people healthy and out of the sick care system, are no longer the trusted messenger that they once were. And so all of these things building on the post-COVID world in which exacerbated the issue around science, which also allowed people to come up with their own individual understanding of what facts are. And that was sanctioned by people in positions of authority. The rise in individualism over a more community approach, which leads to everything from the overt racism and the Islamophobia and the anti-Semitism and the sexism and misogyny and the otherism and the anti-LGBTQ. And so all of these things, this is where you're going to see and hear from me just how hard the last few months have been, because we're dealing with all of these things, but we also have the burnout that started in COVID, the very rightful burnout of the public health workforce, the aging and retiring of the public health workforce, and it's all exacerbated by weak policymakers. So yes, we have faced hard times before, but we have not faced anything like this. And what I think part of the issue that we have to think about is that we have everything coming at us. So we have all of these different things coming at us. At the same time, we have a very clever communications approach, which creates shiny, bright things someplace else. So much of this is happening under the radar to the public. We know what's happening, but the public is not as in tune with these issues in ways that we need them to be. So we need to be targeted and coordinated and collaborative and strategic in ways that we have never been before. And that's where we go from here, is we think about how we do things in a way that is that ignores the noise and lets us focus on what we know the message is. And the message is the public's health is going to be undermined and impacted by these policies. We need to do a couple of different things, and we need to keep it small, we need to keep it targeted in terms of the number of messages, but we need to be large and vocal and uncomfortable in that world, because we need to be the ones tooting our own horn that public health is the place not to cut. It is the place to reinforce, particularly as the cuts to Medicare and Medicaid and healthcare are happening. You can't squeeze at both ends and expect a good result. And so we really need to think about how we can be more focused and attuned to the issues that we know are so important to protect the public's health.
Yeah, thank you for that. You brought up the narratives, so these dangerous dominant narratives that are rooted in individualism that is really taking shape, and we've seen policy come from that. Folks, narratives are unwritten rules, and I had just said earlier, they're just as influential. Unwritten rules have a lot of power. You talked about media, perhaps media advocacy. I just want you to know, County Health Rankings and Roadmaps is already on the ball with this. We're going to be presenting a webinar later on this year about media advocacy and how you can use the media. The media can very much be your friend, as Susan is talking about, as we seek to inform the community, the public, about what is true and what is not. James will probably remember years ago, we were having this conversation and we were talking about how we saw this slip and slide. This is even before the pandemic. Remember, James, we were talking about this. And what did you tell me? You said, the one thing I worry about is folks questioning science. And here we are, some nearly 10 years later, and that questioning science has not been, is exactly what James predicted. So you talk about policy, Susan, and many of us are worn out by the rapid policies coming down that's threatening the years of equity and racial justice that we have worked so hard for. We had some real equity and racial justice wins. So why is it more important now more than ever for the field to maintain its commitment to progress in equity and racial justice?
So I think that the wins that we saw often came through policy at the federal level, at the state level, at the local level, and also private policy. We saw the opportunity for changes in hiring practices that offered opportunities to address these things. So there were lots of different wins that we saw in the past. We can think about from the federal perspective. Let's talk about something that's a few years ago, but tobacco and the
Mm-hmm.
FDA authority over tobacco. That was more than a 10-year process from the beginning, not from when we heard from the Surgeon General in the mid-60s, but from when the attorneys general started to talk about some sort of settlement to when we actually saw a piece of legislation passed that included protections for communities of color, attempting to move forward on things like menthol, but allowing FDA to regulate tobacco was one of those really huge steps forward in protecting the public's health. And it was a very long, slow process. But I will tell you, I was working for the American Cancer Society when it started with the AGs and was on the Hill every day for 6 weeks when we held the Senate hostage when they were looking at the piece of legislation. And I was sitting in my office at the American Public Health Association when the bill finally passed many years later. And I will tell you that was one of those moments when I cried in my office, and those were happy tears. Because to see the result of so much work and so many people finally seeing something come to fruition was critically important. And the Affordable Care Act is another really good example of a federal piece of legislation that expanded access to care in ways that we hadn't seen before. There were compromises all along the route, but creating not just the subsidies, but a national prevention strategy that brought all of the members of the cabinet together to think about what we can do to protect the public's health, to focus on issues around equity, to focus on issues of disparities, and try and think about what each one of those agencies can do. It brings us back to the chart earlier that clearly transportation has a role, education has a role, the justice system has a role. And so the National Prevention Strategy was one of those steps forward that really did begin to offer from a legislative angle, the opportunity to address some of the issues that we were seeing. And we made strides. We saw some decreases in cancer and cancer death. We saw better and earlier diagnosis. We still have such a long way to go, though, because one of our big issues is one of the best harbingers of health is maternal mortality. And
Yes.
as much as we've done on trying to address those issues, maternal mortality overall is bad. Maternal mortality for women of color is horrendous. And so there are so many ways that we need to think about this, but bringing the different components together, federal, state, local, private policy to make a difference and to push points where we can right now. It's going to be different in different times of the year. It's going to be different at different moments of an era. And right now we're in an era where really focusing on the private, local, and state policies to continue to address these issues is going to be one of our best opportunities, because we're not going to see these kinds of things happen at the federal level.
Yeah.
I also just want to make really clear, though, and this will come up a couple other times, diversity, equity, and inclusion is not illegal. Diversity, equity, and inclusion are not bad terms. They're not evil terms. These are terms that we as public health need to keep in mind with every single thing we do. Maybe we need to talk about it depending on where you are. And that's one of the things we need to figure out, is what is the best way to communicate the value and necessity of these kinds of actions and activities.
I'm so glad you said that. We should not be buying into the fact that it's illegal. Thank you. Susan, one of the Oh, I'll let you address this, and I'm going to get back into the interview. But go ahead.
So this is just another example of how we at APHA have really been trying to deal with issues in this time of crisis. And some of you, I'm sure many of you know Dr. Kamara Jones. She was a president of
Oh, yeah.
APHA, and she has been a leader in declaring racism a public health issue for her entire career. And so one of the ways that we have really been trying to think about the gains that we've made and categorize and celebrate is by creating a timeline, a website focusing on this issue of racism as a public health crisis. And one of the achievements that we've had over many years, and this is the royal we, it's not APHA, but the number of different counties, states, cities that have passed some sort of document, policy, some proclamation saying just this, that racism is a public health issue, and we in this community believe that and want to make a difference. And so I hope that even in this time of challenge, we continue to see more and more places, localities take up this issue and work on it in a way that makes sense for their community, because it's
Yeah.
going to be different in different communities.
Yeah, thank you so much for mentioning that. Of course, I got to put a plug in for County Health Rankings and Roadmaps. We now have only had Dr. Kamara Jones as a treasured guest on our platform, but we actually did a webinar just around this topic about declaring racism as a public health crisis and where do we go from there, obviously. So I'll have to make sure we put that in our resource
And
guide so y'all can look
Wisconsin,
at that.
And Wisconsin was the first place that passed, where a resolution was passed on this issue.
Yeah.
So kudos to the university and Wisconsin Public Health Association.
Oh yeah, we've got some true advocates for the and joining us in the webinar too. Some folks who are very much involved in that work. But Susan, I want to shift the conversation about the fact that public health was designed for the public good because the public goods are being threatened, right? And because it was designed for the public good, we often don't think of it as political, but it is. Dr. Georges Benjamin says it is. Public health is political. So that means that power comes into play. That's why we have it in our motto. Power comes into play. So can you share some examples of how the field has organized, often in partnership with others, but to shift policy changes that saved lives? How have, in other words, public health used power to actually save lives?
I am such an advocate for public health professionals understanding that their work is political.
Yeah.
Political, I mean, people think it's a dirty word. People are uncomfortable tooting their own horns. People are uncomfortable talking to people outside of a small circle. And we need to understand that if we're talking about changing populations, we're not going to do it one person at a time. And one of the most impactful tools to make change like that is through policy. And to engage in the policy process, you need to be political. I will admit I come from the world of government relations. I started my career in DC on the Hill, so it has become part of my blood. But it is one of the reasons why I'm so drawn to what public health can do, because thinking about things from a population level, you have to think about it from ways that are sometimes 50,000 feet.
Yeah.
And so what we've been doing at APHA has really been to address these issues of how we can engage in the political process without losing our sanity or our integrity. And you can do these things. You have to do these things. And so there's a variety of different things that APHA has been doing. I'll start with the lawsuits, but it doesn't stop at the lawsuits. These are obviously one of the most impactful tools that we've had since January 20th of 2025. But the truth is, APHA has been involved in lawsuits against administrations for as long as I've been in APHA, and that's 20 years. So we have filed lawsuits or been involved in briefs with both Democratic and Republican administrations when we think that when they could do better. And so
I
right now,
appreciate you saying that. Let me just pause because I appreciate because we have not, yes, public health is political, but it's not partisan. And so I am so glad that you said that. You are about the public's health, not whether it's Democrat, whether it's blue, red. It's not partisan, but it's political. So I apologize for interrupting you, but I just had to reiterate
no,
that.
no, I appreciate that. So we APHA has been involved in 6 lawsuits since January 20th. 4 of them are really still active and ongoing. And so I'll talk about those. Happy to answer questions about the other 2, but these are the ones that are really the most impactful. One that we filed within the first week when we got notification that OMB was going to cut off grants to just broadly the Office of Management and Budget, so that they were the ones who were telling all of the federal agencies that you're going to pause all federal funding, which means it wasn't just billions of dollars to biomedical research or to the Centers for Disease Control or HRSA. It was transportation, it was education, it was the justice system, it was all of these agencies fund federal programs, and they do it through a grant or other ways. And basically, within 24 hours of hearing about it, we had worked with lawyers. We had a case in front of the judge. The judge blocked the order, saying it violated the law because the impact that this funding freeze would have was dramatic, and that was not at all what OMB was concerned about. And so what we were able to do was get money to begin flowing again. It's not been perfect. We know that there have been all sorts of other issues with money getting out, but at least the money has been going out. So that was a success. The other lawsuit that has been very successful, again, not without challenges, was the APHA versus NIH. And so in this was another lawsuit where we've been lucky to work with lawyers. And let me take a step back. Every single one of these lawsuits that we've been working on, we've been lucky enough to work with lawyers, and they're doing the work. They are public interest law firms, so they're doing the work for APHA pro bono, because we would never be able to be involved in the way that we are if we had to come up with the funds. So if you hear good things about Democracy Forward, if you hear good things about Protect Democracy, it is because they are doing amazing work. So APHA versus NIH, we're working with, actually Protect Democracy is one of the lead law firms. And this is the lawsuit that we filed after an executive order that said that the federal government wouldn't be working on anything related to DEI, LGBTQ plus rights, vaccines. There were some issues related to anything that had to do with China, but it was really focusing on marginalized communities that were under this larger guise of DEI and the way that they're defining it. And this is another place where we have had great success. Again, it is not without challenges, and we're continuing to work with the lawyers to expand. But on June 16th, in the middle of actually an APHA meeting, which was great that we got to celebrate it with 300 of our closest public health friends. But the court came down and said that, in fact, this was a violation. The money does need to start going out, that it was arbitrary and capricious, and that the lawyers, the cases or the grants that were part of our lawsuit, so it was primarily APHA members and UAW members who had grants, so there's a list of several hundred grants that the money needs to start flowing again. We are continuing to work with the lawyers, and they are continuing to look at how to expand that to make sure that it is not just this very small number of the thousands of grants that we know were stopped at NIH, but it is a really important step forward. And so this was a place where we should all be celebrating, because the courts are our safe ground right now. Another case that we filed was APHA versus Trump. This is a case where there are more than 30 plaintiffs focusing on the reorganization of the federal agencies. And this included a variety of different federal agencies. Unfortunately, although the case is going forward, the Supreme Court recently came down and said that in the interim, the federal government does have the opportunity to do this reorganization, even as the case is moving forward. So we had a stay in place, but the Supreme Court of the United States, SCOTUS, granted an emergency request from the administration to stay that injunction. So this case is far from over, but as you all know, I'm sure we're seeing some of the implications of that happening just within the last 24 hours of what the government is doing in terms of the RIFs and the reorgs. The most recent cases, the American Academy of Pediatrics with RFK were one of, I think, 5 plaintiffs in this, in which we are working to address the issues that that RFK has done in terms of imposing his agenda on what should be a transparent and science-based process, and that is the undermining of of ACIP, which is the
all of
for advisory committee for immunization practices.
Okay.
So where he got rid of all of the well-qualified people, put other people on, also at the same time put out an announcement that access to COVID, that they were going to take a series of immunizations and vaccines off of the recommended list, which has implications for federal government coverage through Medicaid, through the VA, has implications for private coverage. And so what we are doing right now actually is looking for additional plaintiffs. And of the several hundred people out there, if any of you know anybody, please contact me afterward, looking specifically for people who know women who are pregnant, who are trying to get COVID vaccines and are not able to access COVID vaccine. Parents who are trying to get vaccines for their children through the Vaccines for Children program are not able to access these vaccines. We have some very critical plaintiffs, but we are looking to continue to build that case. This is relatively recent. As you can see, we filed it just on July 7th, so we don't have a court date yet. The lawyers and the administration are going back and forth in terms of discovery and adding more information in declarations. So this is an ongoing case, but
yeah, thank you so much. Listen, on behalf, if I could speak on behalf of the field, let me just say thank you, APHA, for looking out for us. And of course, we forgive you for not remembering those acronyms, not letting them roll off your tongue, because hey, we're in the same boat. The acronyms just kill us. But thank you, APHA, for everything that you're doing to keep the American public safe. In the interest of time, Susan, I want to skip to this question about what it is that we can do, because it's important for our audience to know that there are roles that we can play in shifting power and addressing those structural barriers to health. So can you share a little bit about the Speak for Health campaign that that APHA is sponsoring? And how can we
yes,
participate too?
so absolutely. And that's one of the links that you'll get in the follow-up resources to this page on our webpage. And you don't have to be an APHA member. All of these are available. All of these tools are available. Speak for Health came out of actually it came out of Trump 1 when we were hearing very early on that certain words were being banned. And we realized that public health cannot operate without talking about equity, or cannot operate without talking about surveillance or other really critical words to understanding what public health is and what public health does. And so this has been an ongoing campaign, and it really comes back to that idea that public health needs to be and is political, and you need to engage in this system. And I'm going to challenge folks, because I know people, particularly those people who work for state health departments, local health departments, the federal government, work for state universities, are often uncomfortable being advocates. But the truth is, you all go home at the end of the day, and I suspect many of you have access to a computer or a phone, and that is your own private tool. And you are a representative of the place that you live in your community, and experts, and you can engage in these very simple tools. You can send an advocacy alert. You can share a social media tool to your own friends and family. You don't even have to put it on social media, but if you share it with your friends and family, they can put it on social media.
Yeah.
There's lots of ways that you can engage, but we cannot let them get away with saying that they're not hearing from public health. And so this is one of the most important things. You need to speak up. You need to go to town halls. And whatever, these are the things that, again, it's you and the collective you. Not everybody's going to do all these things, but find the place that you're comfortable and do it. Letters to the editor, direct letters to members of Congress. Congressional staff deal with so many different issues that they need your expertise. Develop relationships with congressional staff so that when they have a question, they can call you. And it doesn't matter where you sit. If a member of Congress calls you and asks you for your expertise, you can give it to them without violating laws. You might have to talk to folks on your campus or wherever you are, but these are the kinds of things you can do. We need and we have to get involved. We have to put aside our general humility as a field and be boastful, because we've added 30 years of life to people's lives since APHA started. So why aren't we talking about that? Why aren't we talking about the difference that we make? Why aren't we helping people connect the dots? And that's what we need to do, really, is connect the dots for people so that they understand the implications of this. And you could do it from a whole array of different platforms and spaces. So this is just some of our action alerts. Again, you don't have to be a member, you can share it widely.
I love it. Susan, the link, by the way, y'all, for Speak for Health, it's going to be in your resource guide. I love how you broke that down. And I love that you said, if you are being asked to share data, folks, you can do that. That is not against the law. Do it. So thank you so much. Susan, I want you to put up, we got to go to Q&A, but I want you to put up the slide with your contact information, because you said that you're looking for, you want folks to reach out to you and stuff like that if they have information about folks who might be able to help support some of the litigation work that you're working on. So I want y'all to make sure you have that. We also have the slides that Sarai has already chatted out, so you have her contact information. I'm going to pause because I know we got lots of questions. Oh, go ahead, Susan. It looks like you want to say something. Say it.
I do. Just there's two things. One is my phone number is wrong on here, and that is the problem of doing these things late at night.
Okay.
It's 2510, not 20.
Okay, no worries. We will make sure that we have it corrected for the resource guide for sure. Joanne, I'm going to shift it to you, and then we'll go from there.
All right. Thank you, Erica. And thank you so much, Susan. I know you didn't have a chance to keep track of the chat, but you got people really fired up, which is quite amazing given that all the context about what a difficult time it is, but you clearly identified ways that people can still take action. So kudos to you. We do have some questions. You did such a nice job of talking about what public health professionals can do in terms of advocacy. And another area is just based on the fact that many public health practitioners have direct relationships with community members. And so you also pointed out that it's part of our responsibility to make sure that the public is aware of all the things that happen historically and behind the scenes with public health that really, if we're doing our jobs, you don't see us doing our jobs, right? And so one question is, how can we ensure that community members or the public are aware of the extent of the impact of public health and how they can use their power to contribute and sort of partner with public health on effective change, both organizationally and on a programmatic level?
So I think we all know that that communities often need to be the ones leading the way. But we also have expertise that we can help bring to communities. And so it is a really delicate and important balance when we are engaging with communities that we offer them the opportunity to come to us. with what it is that they're looking for and use our expertise. But I also think it's one of the most important pieces of the information sharing is that each one of us has our own relationships with people in our communities, and each one of us has the opportunity to be a trusted source of information. And so there's that kind of individual personal community, and then the more geographic kind of or like organizational communities that we have to think about. So I'm going to talk about both of those things really quickly. You are often the trusted voice probably in your family and among your friends when they hear about something related to vaccines, or they hear about something related to stoppage of access to care. So you amplify that, tell them what you know, help them become good messengers, because what we need is non-traditional champions. We need people who are not just public health talking about the value of public health. And when dealing with communities and talking to communities, it really is helping them find out what their gaps are in terms of knowledge, what their gaps are in terms of skills, and trying to figure out ways to get that to them. It's going to be harder now. I mean, you have to be honest, there's less money for the training that we know that communities need. There's less money for organizations to even travel, to be on the ground, to have the real conversations instead of the more forced conversations that often happen through Zoom, or that just aren't as, you're not as likely to get into the nitty gritty as you are when you're there. But take advantage of every opportunity to be a good listener and to offer access to your own network. Because I mean, there are lots of people who are willing to be in places because they know it's important to the public's good, and it's not as much as possible they will make sure it happens. So if it's the worst case scenario, you have to bring in an expert from another city or county, by something Zoom, because that's where the expertise lies, then this is just another time when we need to think about the world creatively.
Yeah, and thank you for pointing out the importance of public health practitioners listening to community and making sure that we're not telling them necessarily what to do or how to feel, but we're listening and then making the connection to how public health is important to all of those social determinants of health. Okay, here's another one. So APHA has a lot of tools on Speak for Health that folks can use for advocacy in their non-professional time, on their personal time, et cetera. Lots of great tools. I took a peek at it. And this is a really good question, I think, is how can we approach public health knowing it's political while refraining it from making it partisan?
And that is the issue. And the thing, one of the best ways to do this is to approach it by just looking at the numbers. And if you're looking at the numbers of people who are healthy and not healthy in your community or around the country or around the world, it doesn't matter what your political party is. Every member of Congress knows somebody who has a preventable illness, who had a preventable illness. Every member of Congress, every member at the state and local legislatures and city councils, they are all hearing from people who are dealing with illness, and it doesn't matter who they are. All this stuff runs across the gamut. The reality is right now, some of the changes that are being made are going to hurt people who are in rural communities, who are in red states, who have historically had less of these resources. And so I think but the truth is that's not what we talk about. We talk about the fact that rural communities have these needs, and these are the kinds of things that we know will make a difference. This is what the data have told us over the years in terms of what makes a difference. Another real kind of secret weapon is that members of Congress don't like to know that other cities, counties, districts, states are doing better than they are. But if you can talk about where things are going well and what it is that made that go well, it doesn't become necessary. It's not a partisan issue. These are the policies that have made a difference in that community. This is where the data come from. But I'm going to give you also another word of warning. No member of Congress is going to want to read a 16-page white paper. They're going to want an elevator speech and a one-pager. And that's going to have to encapsulate everything that we know. And so that's just a really important tool, is we need to keep it short, and we need to make sure that we are engaging with folks. But it doesn't, it's engaging in the process. It is not engaging in the politics of it.
Right. Well said. Thank you so much, Susan. So Erica has come back, and I apologize to our audience if we didn't get to your questions due to time, but thank you so much, Susan. Well, you'll be joining us for the post-webinar discussion group, so hopefully folks will make their way over there after we close. But Erica, you have some more important things to share with our audience
I
now.
do. Before we leave, we got some more important things. Susan, I got a chance to peek in the chat. I mean, people are like, girl, you on fire. This is what we needed to hear. And it's true. It's true. I mean, we are struggling, but at the same time, we need to know that we have a voice. And County Health Rankings and Roadmaps has been singing this for a long time, that civic engagement, civic participation actually helps. It helps you become a healthier person, not only because you're having a say in the policies and stuff taking impact your health, but just having that agency, exercising your agency actually is a good thing for your emotional and mental health. So do it, take part of it, do get in to speak for health. Other people are chatting things or other things you can get involved in. We have a voice, and that collective voice is powerful. So let me share some other goodies with you. Our What Works for Health database has over 400 evidence-rated strategies to help you in your community health improvement journey. Here are 2 strategies that I want to highlight. Of course, they're going to be in the resource guide, but our Civic Health curated list of strategies help you strengthen opportunities for people to participate in their community. You hear Susan talking about it's so important that we participate in our community. Another strategy, social media for civic participation. You heard Susan talking about how you can use social media to help advocate for our good, quite frankly. So this strategy has been known to or expected to increase both civic and political participation. Of course, check it out. It'll be on your resource guide. And calling all students, researchers, advocates, and community members. CHR&R's 2025 Data Visualization Challenge is here. So we want you to put on your creative hat and design original visualizations. That's a really hard word for me to say, but I'm not going to try to say it again. But we want you to show how you can visualize, see it using CHR&R's data to communicate the structural determinants of health, or those laws and policies that we've been talking about, the power structures that drive health outcomes. So we are accepting submissions until August 1st, and who knows, if your submission is accepted, you may end up on one of our social media posts or may be invited to collaborate with us in the future. I'm going to ask Soraya to chat out where you can get more information about that data visualization challenge. And speaking of data, this is a reminder that our Meeting the Moment series will continue next month with a spotlight on data. So how can we use data to meet this moment? Doctors Tammy, Doctors Tammy Govea, Christine Maganda, and Commissioner George Dunlap will share how you can do just that. So register now at our website, and don't forget to plan to join us for the discussion group that's going to follow that webinar. Please be sure to complete this brief survey that Soraya is chatting a link to. We love hearing from you. It helps us improve our webinars. It's one of the ways that we knew we need to bring you this Meet the Moment series. So please be sure to fill that out. And Soraya, go ahead. The wait is over. The suspense is over. Please join us in the discussion group. Again, Susan will be joining us, and I really am looking forward to hearing about the work that you're doing in your community. So go ahead and head on over there in a few minutes. Please stay connected to us. The best way to find out about our resources is to sign up for our newsletter, but we also have a presence on social, Facebook and LinkedIn, so be sure to visit us there. Listen, we're going through unprecedented time right now. So I just want to personally thank you for everything you do to create equity in your communities. I will see you next month, and I will see some of you in the discussion group. So thank you for joining us today. And Susan, thank you for your wisdom. We appreciate you.
Thank you for inviting me. This was good.
Yeah.